Thank you so much for joining us, Lauren Elliot. Lauren is the founder and CEO of Candlelit Therapy, which serves as a safe space where Black mothers could receive better behavioral healthcare options, treatment, and resources. What is the public health challenge that you are addressing with Candlelit Therapy?
What we are addressing at Candlelit Therapy in a lot of ways is the high mortality rates and morbidity rates among Black women, Black mothers. We are also noticing a lot of disparities that are happening across mental health conditions, from access to care, from just acknowledgement of what symptoms are, and educational related gaps in care.
So what is the solution exactly to fill in the gaps in care that we're experiencing?
So we're looking in a lot of ways as our solution as an intervention that facilitates screening. So this is essentially allowing care providers to better assess and early identify mental health symptoms and mental health challenges. So really looking at the pregnancy period of being a wealth of opportunity to check in on moms, see how they're doing, seeing if they're being heard, and are able to communicate how they're feeling to their doctors. And also a component outside of the screening portion, what we're looking to do is augment the delivery of mental health care.
I was wondering what really made you think that this is the way to really combat this type of problem?
So personally, as a mom, I had a relatively healthy pregnancy, but I did notice that there were gaps when I did need more education about what I was being told by a care provider. So for example, they very well they were very articulate about explaining that I was going to need to be screened for gestational diabetes, for example. That was a process that was very clear. There was a test or an exam that was associated with it. I got clear instructions on how to go about that. My results were I was able to communicate results, and my provider was able to share with me what that all meant, like the importance of getting screened for gestational diabetes, as well as the importance of how it can impact my baby and my health outcomes. Although I didn't see that same attention paid to my emotional or mental health throughout my pregnancy or even in my postpartum period. For me personally, when my postpartum period after I gave birth to my son was when a lot of those emotions started to arise. And what I've heard from other moms is that is usually when they are engaged with mental health care professionals, and it's usually attached to postpartum depression. And I think postpartum depression is the most well-known condition, but there are more than just depression cases or depression-related emotions or symptoms that can manifest at that period.
So I'm wondering, how come entrepreneurship? How did you enter this kind of role in deciding to be a founder and taking this kind of route to address this challenge, as opposed to continuing to work for the DOH, for example?
That's a great question. No, I really wanted to take on that challenge of something has to change. I knew that I had a certain level of knowledge from working at the health department. I dealt a lot with coordinating research. So I would arrange focus groups as part of working on mental health campaigns while I was working for the health department. I also coordinated trainings. So while I was at the health department, I was certified in mental health first aid training. So having the knowledge of hearing firsthand from people who were on the train with me, who walk alongside me right here in New York City, where they felt were the gaps, where they felt like they didn't have anywhere to go when they were feeling depressed or anxious. Hearing that firsthand was very powerful. So at that point, I felt that I had gained enough knowledge to be able to really create something of my own.
And so what is the response from mothers with your solution?
Yeah, so what we're hearing in a lot of ways is, wow, no one's ever asked me these questions. No one's ever cared. No one's ever asked me these questions. No one's ever expressed a care for what I'm going through, and just answering these questions alone feels like a release. It feels like it's an outlet. So a lot of women have compared our questionnaire to an outlet in itself of like, I have never been asked these questions. And now this feels like I'm able to have a space where I can communicate how I feel, because I can't communicate how I feel in any other space in my life.
So I'm wondering where you view your solution evolving based on our current circumstance, and how you view the challenge really evolving itself.
You know, especially I'm a Black mother raising a Black son, and that's been highlighted a lot across the country of how do we protect our children as Black parents? And my answer to that question would be preserving the mental health and well-being of the entire family structure.
How people can find out about your product? How can they enter this community?
Yes, so right now we have not launched yet. We are prepping for a beta, but you can definitely visit our website at livecandlelit.com.